Hello everyone, I'm Dr.Aruna Vishwanathan, practicing ENT surgeon and doctor for 30 years. I'm here to help you if you have early symptoms of COVID or if you're home. So how can you treat it? There are two things here. One is your immunity and the second is the viral load. You want to keep your immunity high, you want to keep the viral load down. So we're going to speak about quick, simple, easy things to do it. So first, how do you commonly get it? I'm seeing patients, people walking in with gloves. You need to know first, we all know how to wear your gloves, right? Before you go out, if you're going shopping anywhere, you're wearing your gloves. Everyone knows how to wear the gloves, no problem. But before you wear it, of course, wash your hands well between here, the thumb, the nails, and then you wear your gloves. And then, you have your masks. So you have different types of masks. So when you wear the mask, remember, like this metallic part, this would be up, because I've seen people wearing it the wrong way, because this gives you a good protection. And then the other thing would be, if you have a mask like this, you wear it around your ears. The most important thing is, how do you take it off when you come home? This is where, after touching everything, you're probably bringing the virus home by not being careful. So in your left hand, you would pinch this, what you would do is you'd pinch the center part of the left hand, and then you're removing the glove out and then taking this into your hand. So I haven't touched anything. Okay, so here, like, you have a super fist here. The glove is right inside, no contamination, nothing. And then with this finger, don't touch the outer part. I would put it in. You can see here the loose, I just take it inside, put my finger in, my index finger, and then I'm inverting it. You can see that I have touched nothing and it's completely clean. So any contamination would be here. You put it in the dustbin, you would close the dustbin, and that is done. And then you would wash your hands well, and only after you've done a full hand wash would you remove your mask. This is very important because many people are forgetting this simple and easy thing. And even the other thing, what you would do is, like I said, to keep your immunity high, you would eat as a very healthy food with a lot of vegetables, whatever you like. Make sure you have lots of colors, and eat simple, easy, digestible food, nothing complicated. And vitamin D is super important. And how will you reduce the viral load is, usually the virus is in the nasopharynx, the junction between the nose and the throat. So inhaling steam with a teaspoon of salt, a bit of turmeric, and tea tree oil is great. And also the anterior nasal wash, two ways. You can use a red rubber bulb or even a simple syringe if you don't have a neti pot. So you take a teaspoon of salt. You can even add a drop or two of betadine inside if you want. And then after the water has boiled, it's warm enough for you, comfortable, you would take it, put it in one nostril, bend over the basin, and then you would let it only come in. You don't want it going in where you feel uncomfortable in your ears, your sinuses. So I will show it in my other videos which are coming up, but this is a very simple practice. If you don't have anything, take a simple syringe and flush just the front of your nose, and that is great to reduce the viral load. Other thing, nasal drops, don't forget. And then washing, this also helps a lot. And the steam inhalation may seem simple, but at that temperature it really helps to reduce the viral load. Drink lots of hot fluids, any kind of herbal teas. If you have tulsi, ginger, turmeric, add all of this. And the main thing what you want to monitor at home would be your oxygen saturation. So I really think everyone should have a pulse oximeter. This is an easy to use device. Again, a lot of people have it, but you need to know how to use it. So you would open it like this and then put your thumb, you can see. So the nail side is facing up. Place it comfortably till a proper contact is made. Switch it on, and then it will take a reading. Usually it's 9900, or So anything, you should know what is your normal for you and keep monitoring it maybe 3, 4, 5 times a day. If you feel breathless more often, it's really important, because this is the one thing which helps you to know when you need to contact a doctor for medical help. Keeping your lungs strong is very easy. My earlier videos speak about strong lungs, healthy lungs. You can go back to all of that. I don't wish to repeat. All the other vitamins again are there in my earlier videos. And one simple thing which would really help is also the chest physiotherapy. So how we do this is my beautiful assistant Yogita. She doesn't have COVID, but what we would do is, if the lungs are like this, you would every day tap the person. Of course, you make sure you wear your mask, you wear your gloves, and then you would. Okay, so this is how you would actually protect yourself. Since we are not physically seeing patients, we are only doing teleconsultations. We are making sure we are free of COVID ourselves, so that is why we are okay to do it for each other like this. So like a T, the top part of the lungs, the vertical part, and then the base. All this really helps to bring the mucus out. Thank you so much, Yogita. Thank you. So this is really super helpful in getting everything out of the lungs. Make sure you sleep for a long time, and most important thing is stay calm. Really staying calm makes all your immune system really active. Every single antibody, the T cell response, everything is super fantastic when you're calm. How to stay calm? Go to my earlier 4-7-8 breathing. There's also a video called ABC, that is from anxiety breathing to calmness. There are lots of help, because really there is no other intention other than for you to be calm and happy and comfortable in your home. And if you need medical advice, please make sure you reach out to someone. It's really important that you seek help. If your oxygen levels are going down on the saturation, you must reach for help. And the other things about cleaning the knobs with sanitizer, all of this I don't need to tell you, but all my other earlier videos have the different treatment protocols. So really the main thing I'm saying is, don't panic. If you've been diagnosed positive, it's completely all right. It's not the end of the world. The coronavirus is what causes the common cold. So really don't be afraid, don't panic. Reduce your viral load with all these ways I told you. Increase the immunity from the earlier videos, and you will clear the virus. You will be fantastic. And seek medical help. This is not a substitute for that. You can follow all the CDC, WHO, whatever guidelines are there. And really, your health is our concern. And do not panic, because this too shall pass like everything else. Take care. God bless. Thank you so much.